Diseases, external conditions, tends to be acute and located on the surface of the body. These include colds, flu, fevers, skin diseases, and rheumatic condition. Generally, these are subclassified as wind cold or wind. The pathogenesis of external diseases. The pathogenesis of external diseases begins with an invasion by one or more of the 6 pernicious influences: wind, cold, heat, dampness, dryness, and summer heat. See Chapter 8 for a discussion of this. The effects of this can penetrate the upper respiratory passages, including the nasal passages, the mouth and throat, the bronchioles and lungs, as well as the skin and hair. When this occurs, all physiological aspects associated with the lungs can be affected. Besides, the upper respiratory passages, the skin, body hair, and the external immune system, Wei Qi, which are all governed by the lungs, can be damaged. The resultant acute fever, cold or flu is an attempt by the body to throw off toxins and overcome negative pathological invasions. Next, the most definitive signs for external wind heat or wind cold are chills followed by fever, normal tongue, core, and a floating pulse. In addition, there may be symptoms of headaches, nasal congestion, dilute clear or whitish discharge, white and thin tongue coating, and a floating pulse. The difference between wind cold and wind heat conditions is that chills are more pronounced in wind cold disease and fever is more predominant in wind heat condition. External wind cold or external wind heat. External wind cold or external wind heat also refer to various imbalances and diseases of the upper respiratory tract, including colds, influenza, rhinitis, and other respiratory allergies. Rheumatic conditions are also classified as external damp wind cold or external damp wind heat. Wind is a pathology that commonly accompanies external conditions. External wind can refer to the proliferation of various bacteria and viruses. The fact that the Chinese character for winds is a small insect suggests that perhaps they suspected the existence of external pathogens such as germs and viruses. External. External can also refer to certain rheumatic disorders and skin conditions. These can be treated with herbs and formulas from the categories of relieving cold, wind dampness, or relieving hot, wind dampness. In these cases, the wind relieving properties alleviate pain because of their antispasmodic analgesic effects. The method of treatment for external disease is diaphoresis sweating. For this, one would select herbs and formulas from the categories of cool surface relieving or relaxing diaphoretics, or warm surface relieving or warming stimulating diaphoretics. Next, wind cold. External wind cold includes Symptoms of chills, fear of cold, avoidance of cold drinks, mild fever, headaches, itching stiffness, nasal congestion, allergies, colds, and cough with clear or white colored sputum. The pulse feels floating, beating more on the surface than as usual, tense and slow, around 60 beats per minute or less. The tongue has a thin white coat or coating. For external wind cold, external wind cold, external spicy warm diaphoretic herbs are used such as Ephedra sinica, fresh ginger, gingiberis oak, Asarum heterotrophoides, cinnamon twigs, cinnamon cassia, or western herbs such as Sassafras albidum, onions garlic, Allium sativum, and Angelica archangelica. External cold, excess condition, Ephedra combination, Ma Huang Tang. External cold condition in an individual who is neither two, excess or deficient, Pueraria combination, Zhejiang Tang. External cold and deficient condition, cinnamon combination, Guaishi Tang. Another external, spicy warm formula, Sisonipta and Lidiborrelia combination, Qingfang Bai Dusan, which is especially useful for acute skin diseases such as boil, urticaria, eczema, dermatitis, and conjunctivitis. Used in Ayurvedic medicine include Trikatu, consisting of equal parts of powdered black pepper, pepper nigrum, pipali long pepper, piper longum, and ginger gingiberis officinale. Tito paladi is also used. It consists of powders of cinnamon bark, 1 part, cardamom, 2 parts, black pepper, 4 parts, black bamboo, tabashir, 8 parts, and raw brown sugar, 16 parts. Western herbalism. Western herbalism uses a formula called composition powder, which consists of bayberry bark, 4 parts, white pine bark, 2 parts, ginger, 2 parts, cayenne pepper, 1/2 part, and cloves, 1/2 part. External wind heat. External wind heat has more inflammatory or feverish symptoms, including high fever, sore throat, eruptive skin rashes, and thirst with a craving for cool drinks. These conditions can also be indicative of influenza, colds, upper respiratory problems, hot eruptive rashes, and acute inflamed joint pains. The pulse is floating but fast, 80 or more beats per minute, which indicates heat. The tongue will have a thin coat, slightly yellow and dry. Chinese herbs for external wind heat include cool, spicy, diaphoretic herbs such as chrysanthemum flowers, chrysanthemum. Okay, let us go to next slide.